Coming up on FaceTime.
You got to know something.
Yeah. Eyes are the window of the soul.
Ophthalmology is a goal.
That was an inspiration for you going into the field of medicine then?
I chose to become a doctor.
International collaborations.
Better resources.
The one person, one day.
1,000 IND.
And the Flying Eye Hospital.
Guangzhou and my hospital as a host.
There must be some standout memories.
The sunset. Just come through the window.
Yeah. Hello, I'm your host Matt Horn. Welcome to FaceTime. There is a saying that eyes are the window of the soul, indicating the importance and value of vision. The loss of eyesight is a great tragedy, and today's guest on FaceTime has dedicated his life to the prevention and treatment of ophthalmic diseases. Welcome Dr He Mingguang, Vice Director of the Zhongshan Ophthalmic Center of Sun Yat-sen University. Dr He, thank you very much for coming on to FaceTime.
My pleasure.
What made you choose eye surgery?
You know, for eye, we have a terminology called ophthalmology.
Ophthalmology.
Ophthalmology is a science to study the disease of the eyes. In Chinese, we have a proverb. We call it like 金眼科, 眼外科, 吵吵闹闹妇产科. That means the ophthalmology is a gold, and then surgery is a silver.
Right.
Gynecology is only noisy. When I finished my medical school in 1993, and then I start my work in this eye hospital, and I become an eye doctor. At that time, I didn't really understand what ophthalmology means. But then later on, the many story, and then I'm going to tell you later on, and then maybe choose this as my career.
Were you from a medical family?
I'm from a patient family. And my mom got a little eye problem, and
when you were young, then?
Yes.
Did you
that's
feel?
Why I got, in family I got a twin brother, elderly brother. My brother is an engineer.
Right.
But then my parents told me like, oh, we better have a doctor in the family.
Yeah. Because and that was an inspiration for you going into the field of medicine then?
Partially, or like in the early childhood, yes.
Yeah.
But later on, I chose to become a doctor because I feel like many people really need us to take care of.
Sure. And your studies continued abroad? Let
me just try to tell you one little story.
Okay.
In 1997, I went to we call rural field, like a village, for like a prevention of blindness program or whatever. And then I just bumped into a very old lady, like 75 years old, and she stayed in her house like forever, because she got very poor vision, and then her life is always like the bed, the toilet, and between the bed and the toilet is a rope. So every day just move with the a little guidance of this rope, and go to the toilet and go back to bed. It's such a kind of miserable life. But then the problem of the eye is only cataract. You know, cataract is a disease in ophthalmology that really easy to treat. So as a doctor, you really shocked because the lady only got this little disease. Can be easily treated, but nobody treated.
And how long had she had it?
I think 10 years.
10 years.
So stay in the dark, 2 point, one room for 10 years. Very, very miserable.
It's a very telling story.
Yeah. Then I understand that, and then I think as a doctor, with only one hand, you can only do one surgery one time. But why not we do something like we train more doctors to do more surgery and help more patients? But at that time I wasn't really understand how to do it. I didn't really understand what to do, how to do it. And then I chose to study and in the best public health school and also the medical school, in order to be able to understand how to do it, how to design a program, how to implement it, how to write it a paper and think.
So you had a very clear goal when you went abroad?
Yes.
What's the satisfaction at seeing it grow in front of your eyes and seeing that the number of people you can treat growing? How satisfying was that?
Because in my philosophy, I always I have a dream. Like I follow the dream. So I don't really decide what to do first, and I really try to understand why we do it first. So in the Department of Preventive Ophthalmology, I think that because the dream is to serve more people and then train more people to be able to do it. like to increase the coverage. So the stronger the department is, we are able to fulfill this dream a little better, in a better way. Yeah.
How important are these international collaborations in improving eyesight here in Guangzhou?
They are the one really understand what to do.
Yeah.
And why to do. In the collaboration, we not only receive the funding, money, we also have the expertise. So we are able to have a little better resources to do things that are consistent with why we do it.
Yeah.
And then we also learn the expertise from the experts, and then we are able to do it better.
You had a project that you're involved with, the One Person, One Day project?
Yeah, it's really a 100% local NGO not-for-profit organization. Right. And then the idea is that because after I went back from the UK, I established and strengthened this department. But most of the resources from overseas investment, like collaboration, like IBB, Helen Keller office, whatever. But then I start to realize that we can really count on overseas collaboration or overseas investment forever.
Right.
And then we got to establish something local, and we got to inspire the local people, donate their money and their willingness to help and then establish an organization, a structure that able to work out programs and really able to help the poor people more effectively. So the idea is really a little bit, one day, one person is come from a little Buddhism idea, because in the Chinese philosophy, many people think 有所得有所失. That means you gain if you receive a lot.
Yeah.
You got to lose something.
Yeah.
You gain too much, and then you got to lose too much. And then I think most of the rich people, they receive fortune of money, many money, but they worry maybe they got to lose something in terms of like the health, the children, the healthy of the children, all these problems. And then they would rather donate money as a way to lose. So that's the concept.
So it's got a cultural root,
right? Yeah, cultural routine. They're ready to donate.
Yeah.
But they, first of all, they don't really know who is the reliable organization to donate. How we are going to be able to really donate money and help the poor people. We established this NGO under the umbrella of my hospital.
Right.
So it's not an independent registered organization. It's just part of the organization in the hospital. So one day, 1,000 IMB to help one cataract patient got their vision recovered. The surgery done. So it's just one day, one patient. So one day only. Yeah. What you have to do is just 1,000 IMB for one day. So some people donate like 200,000. Yeah. To have like a program for 200 days. Because in 1 year we only got 200 working days. Sure. So they donate 200,000. But some people only donate like 5,000. They said, I only want to help 5%. I think that's fine. That's okay. Everything you got to be transparent. Transparent to your donor. So what we did is we create a calendar for every individual donor. All right. So that if you are a donor, you have a little password, you get logged in to your program calendar. Yes. Every day you can see one patient's name. And if you click on the patient's name, you're able to see all the details. Right. What's the visual acuity, what type of surgery has been done, what's the post-operative visual acuity, everything. So the donor really understand all the money they donate really be transferred to the patients who really need this help. Who are the patients? How are the patients chosen, who get the treatment? Very good question. Most of the patients were chosen in the poorest region in the province. Because in Guangdong we work with about 30 county hospital in the poorest or poor area, like West Guangdong or Northern Guangdong. And then we develop a training program, because before the program, that nobody able to do any cataract surgery in the county hospital. And then we train one surgeon be able to do this surgery. And then later on, we develop a capacity building program to increase the volume of the service, like try to help them do more surgery. Yeah. So as part of this support, we use this one day, one person program funding to support this local hospital. So if a patient come in, in China we have a medical insurance system. So the insurance system is able to reimburse some of the medical costs.
Yeah.
And this policy can be quite different, depending on the area. So in some of the area, the insurance only reimburse 200, 300 IMB
right.
for one patient.
Yeah.
So, and then if the patient is really poor, they are not really able to afford this out-of-pocket money. So this one day, one person foundation will subsidize all their out-of-pocket money. And the maximum amount is 1,000 IMB.
People like this woman you mentioned earlier with the rope.
Yeah.
Has she been helped? Was she helped back in the 90s?
Yeah. After I saw her in 1997, I did surgery for her. So she's doing well, yeah.
So way back then, 12 years before the one day, you saw how important this work is.
Yes, exactly.
You mentioned Orbis, one of the organisations that you're working with, and the Flying Eye Hospital. Tell us about your links there.
The Flying Eye Hospital, the Orbis, in 1982, is I think you should call a maiden voyage.
Yes.
It was like in 1982, they choose the Guangzhou and my hospital as a host.
Yeah.
Host city and host hospital for their the maiden voyage.
Yeah.
In 1982, and then after that, we have a very small program with Orbis occasionally.
Yeah.
But until there's one professor called Nathan Condon, he's one of the overseas faculty professor from US working in my department. So he linked us up with the Orbis and developed this new Flying Eye Hospital program, and also some more comprehensive eye care training program for the county hospitals.
They come and they can return with the necessary skills to carry out the work.
The idea is like that because before we already established a training program, but mainly for cataract surgery. So most of the doctors over there, they are able to perform cataract surgery, but only cataract surgery.
Right.
So in this Orbis Flying Eye Hospital program, we wanted to consolidate more subspecialty like glaucoma, diabetic retinopathy treatment, and all this refractive error. All this, and then we hope we're able to develop a more sophisticated eye department, rather than the department only provide cataract service.
And I know that your hospital is working with Orbis on a new 5-year project.
Yes, the new 5 years project aims to develop this, as I mentioned, comprehensive eye care. Yeah.
And another hospital is involved there, the Women's and Children's Hospital.
In Guangdong we have 10 county hospitals involved, and then the Women and Children Hospital is one of our partners. They're not they're not a hospital for training, but they're one work with us to deliver the training service.
Throughout your career, what areas of research have you been most focused on?
Because I got my training the training I got from US and UK, they're mainly on like epidemiology, program planning, public health. So most of the program is on epidemiology and a little bit genetic like twin study and glaucoma. But then now we are running more operational research.
Right.
Like we are running a trial in order to compare which approach is the best to deliver the service. Something like that. We call it operational research.
How long will that research take?
It depends on what you're going to do. But mostly, for example, if we develop a program, try to establish a counseling service for the clinical, into the clinical service. The idea is that a lot of patients, if you tell them, oh, you got glaucoma, we're going to operate on you, but then the patient, even after surgery, they won't be happy because they don't receive sufficient, information about glaucoma, because we got to have a counseling program in order to make sure they understand all these concepts. Like the surgery is to reduce your pressure, it won't improve your visual acuity, all these communication. So we develop a counseling program in order to see whether preoperative counseling is able to help the patient have a better satisfaction. And then we run a randomized trial in order to compare counseling without counseling, which one better. That's the kind of idea, yeah. It can be quite short. To improve services for many years to come. And patient satisfaction as well. Yeah.
Dr. He, we've talked a lot about treatment. What can people do in terms of prevention of eye problems?
That's a good question. I think most of people say like prevention is always better than treatment.
Yes.
Yeah, but I think prevention, we've got to understand in two different ways. one way is to prevent onset or development of disease. Another prevention is called to prevent to have a severe consequence when you already established the disease.
Yes.
So there are two ways of prevention. So I think in most of the eye diseases, there are a little way to prevent the onset of disease. For example, in ophthalmology, we have a childhood blindness.
Right.
And the most common, in the previous time, most common reason for childhood blindness is vitamin A deficiency. So in Africa, I think IAPB initiate a program to supplement which vitamin A capsule.
Yes.
So this is a very easy prevention strategy, and then it improve and I think reduce about half of the childhood blindness in Africa country.
And for those people in the poorer rural areas here in Guangdong province, how can they get involved? How can they come forward and have the eye treatment that they need?
It depends on their affordability, because now at the moment in Guangzhou, as far as I know, the insurance already well cover the residents. So in most of the scenario, the patient, if they come for the cataract service, the charge will be like 6,000 or 7,000 RMB. But then among these 6,000, 7,000, they have to pay a little bit out of pocket, like 2,000 or 2,500, something like that. I think most of the patients is able to afford this out-of-pocket money. But if they can, they got to talk, first of all, if depends on where they are. If they're in Guangzhou, they got to talk to the hospital. Because in our hospital, we have a program. We have a charity cataract program. Also, we are able to provide cataract service for those who are not able to afford the service. So we would just register them, and then we contact them for the service.
So they do it initially at the county hospital level, and then they get referred to your hospital.
Or if they work in the county hospital, probably the simplest way is to log in our website and see where we work. If they are in our working area, they may just go direct to the county hospital, register, and the one person foundation will be support.
Doctor, it's clearly very important work that you do. I'm sure over the years you've been working, there must be some standout memories, special memories of people you've seen their lives change.
Yeah, there are many stories because we have been operating on too many patients. But the one I really won't forget is that I think in one of the New Year, I think before the New Year, like the New Year Eve, we did surgery on one very old lady.
Yeah.
And then in the morning, like about 8 a.m., I went to the inpatient ward. I just walk, stand right beside her, and then I uncover the mask on the eye. After surgery, you gotta put a mask.
Sure.
And then I uncover the mask, and then at that time, 8 a.m., and then the sun said, just come through the window.
Yeah.
And put it on the face of the lady.
Sure.
And then the lady was so shocked because he has been in the dark for many years. I'm not sure how many years, but for many years. That was the first time she's able to see the sun in the New Year, the first sunshine in the New Year.
Beautiful.
So very, very good experience. And
so then, very special memory.
Yeah, very special moment that I think everything I did is very rewarding.
And is it those moments that inspire you to keep going and to keep developing?
Yeah, exactly. Yeah.
Well,
but also the dream as well. Yeah, this is just a moment.
So the dream of
the dream of providing more service to the patients who are in need.
Sure.
Yeah.
Well, we're at the section of the show we call Guangdong in Your Eyes, and you being an ophthalmic expert, it's very appropriate that we.
Yeah.
So, what have you brought with you that sums up Guangdong in your eyes?
This is a souvenir.
Ah, okay.
From the hospital.
Yes.
I chose it.
Yeah.
It's a scarf.
Yeah.
Consistent with what we are doing.
Yeah.
It just keep people warm.
Ah.
that's the scarf with the hospital name.
So it sort of reflects what the hospital is trying to do.
Exactly.
But it's a beautiful thing to bring. Thank you very much.
Yeah.
Thank you very much, Dr. He, for being our guest on FaceTime.
Yeah, my favorite.
And please keep up the great work that you're doing here. We really know that you are changing lives.
Sure, fantastic.
Thank you very much. So that's the end of another FaceTime. Don't forget you can catch up with all the latest news on our Weibo page and watch shows on our blog. And please feel free to contact us with any ideas, suggestions or comments about our show. I've been your host Matt Horn with all the latest here in China from GDTV World Headquarters Guangzhou. Bye for now.